small one on his cheek that he's had less than a year. So give me a smile again. So you see when we smile, we're trying to hide it along our skin tension lines. Okay, good. You can relax, okay? Gonna put a piece of gauze right underneath you. And you shouldn't feel anything other than my touching you, okay? Nothing sharp or uncomfortable. So he says this has been squeezed before, but never been inflamed or infected. So that's a good thing in terms of us being able to get it out in one piece. Make sure again nothing hurts. Make sure nothing sharp or uncomfortable. I think I'm already on the inside of it. Let's see here. You all right?
Mm-hmm.
Just tugging you. Where's that hospital? I've never heard of that hospital.
It's
Okay. Squeezing you a little bit because I think we can't get that. Oh wait, actually I think that, wait, don't touch it yet. Don't touch it yet because I'm with the sac actually. Let's see. No, I think this is right here. See if I can get it out entirely here. I think we might have gotten the whole thing out there, and that's a good sign. Let's take a look and feel and see how flat it is. Okay.
it's people that basically they have severe mental illnesses and they've come into contact with the courts.
Really?
So a lot of people that are not guilty by reason of insanity
Oh my.
or
I
incompetent.
know we had that going on over there.
Yeah. Well, it's the biggest hospital in the country.
It's the biggest what in the country?
The biggest forensic hospital.
Really?
There's 1,500 patients.
Oh my goodness. And they're all deemed mentally
It's all severe mental disorders.
Severe.
Mostly schizophrenia.
I had no idea. So they come from all around the nation, really?
Well, no, from all around California.
Oh, okay. I think I got it all. And that was really small. And I'm actually very impressed with the size little hole we made to get that all out. But I'm pretty convinced we got it all because it just looked like the entire sac was almost intact there. So I'm going to actually show it to you. But it's almost like I don't even think he needs a deep stitch because it wants to close just like that. But I will put one in anyways because I have it here and we might as well. So you must see some interesting things. Maybe we wouldn't think it's so interesting, but I mean, you won't think it's so interesting, but
Well, it's
we
like,
would.
I mean, a small percentage of the time it's quite interesting, and
Really?
but some of the time it's pretty boring.
Okay, got it.
It can go from killing both your parents because you believe they were demons to stealing water from Rite Aid because you were disorganized.
So it's kind of like, is it kind of like the ER where you never know what's going to walk in the door kind of thing?
Yeah.
Wow.
Although on average, tends to be more serious crimes. A lot of assaults.
Yeah.
People that commit assaults because of their illness.
Can you trim this a little shorter right here? Just right there. Thank you. So I'm going to put a deep stitch in, meaning that this stitch gets absorbed over time and it gives it strength over time. It actually closes real tight despite that, but it gives us an extra added protection there from it, this suture, making sure the suture line stays as small as possible.
Okay.
So that suture does not come out, but these top ones, which are probably just going to have like 2 of them, are going to come out in 1 week, 5 to 7 days. And we'll show it to you. You may very well be able to do it yourself, or you might even, I don't know if you'll find somebody where you work to do it. Cut that one a little shorter. Okay. So it doesn't look like he's got a little whisker on him, his face here.
So is there any reason why it's a good idea to get this kind of thing removed, or is it just totally?
I think it's not, when it's right in the middle of your face, you can see it. It's not very attractive,
Yeah.
things like that. I'm going to show you. Do you want to see what it looks like?
I guess.
What do you mean you guess? Can you see without your glasses? You need glasses.
Yeah, I can see.
You see this? I can show that little spot here.
That's nasty.
It's not that nasty, but see that's the contents that's squozed out, and
Oh,
there's a
yeah.
sac that contains it. See the
Yeah,
sac here?
I don't want that on my face.
No, but it's gone now.
Good.
Looks nice.